Hello everyone, I'm your host Brenda. A very warm welcome from beautiful and socially active Wollongong. Today we have a renowned clinical nurse consultant with us, Aaron Wilson. Aaron is celebrating 20 years in nursing this year. He has extensive experience in public health care and is the owner of a well-known private practice called Urology Nursing Solutions. He specializes in urology, continence and catheter care. Welcome Aaron. Thank you for joining us today.
Thank you, Brenda, for that warm welcome.
Aaron, what factors do you consider when recommending an intermittent catheter to your client?
So there are three main factors when selecting a catheter for intermittent self-catheterization. First off, we want to make sure our patients are comfortable in using the product, which will therefore raise their confidence in continuing the use of intermittent self-catheterization. We also select a few different catheters of them to trial first to make sure they suit the needs of the patient. And everyone's individual, and there's many different catheters on the market that can help. Also, there's available funding. There's actually 20 different available funding sources in Australia. Accessing this can be very daunting and hard to navigate. So nursing staff can also help navigate that space and maximising getting access to these products and helping them use these products moving forward. Also navigating through a reputable retailer in accessing these catheters to maximise their funding capabilities of the package that they are on, to make sure they get the quantity and quality of service required to maintain continual use of intermittent self-catheterization.
Thank you, Aaron. Could you please dive a bit deeper into the clinical factors of choosing an intermittent catheter?
Lubrication is the key when choosing an intermittent self-catheter. So there is non-lubricated dry catheters on the market, which can add a layer of complexity when learning how to do catheterization, as applying your own lubricants to it can increase risk of infection, cross-contamination, and potential urethral trauma in using such catheters. I always recommend a pre-lubricated catheter or ready-to-use catheter. Also, a clinical factor is the non-touch technique in placing the catheter. Will minimize infection risk, simple, straightforward design, and come with the packaging to help aid insertion for their poor dexterity matters.
Thank you, Aaron. Ease of use and simplicity is the key. Can you share some real patient experiences where people found difficulty and you provided a solution?
I classically see this all the time come into clinic, where a patient would be catheterizing with a dry, unlubricated catheter, and over the years, they can suffer from poor dexterity issues. I'd introduce them to Actreen products. The Braun Actreen is a simple, straightforward design that has pre-lubricated glycerin. Because it is glycerin based, it's bacteriostatic. The Actreen packaging is simple, tear open, and easy to use. The Actreen is not a free-flowing liquid and does not create a mess as you're opening the packaging. The catheter is flexible and stays upright. This is easier to insert and remove. They also come with different packaging processes that aid in a non-touch technique to maximize the efficiency. The drainage holes are located at the tip of the catheter, therefore reducing the chances of deep trauma to the bladder. The simple design makes the user more comfortable and less stressful.
So how do they fit into the funding criteria that you discussed earlier?
So the Actreen products are very well competitively priced. Also, check out Medisa. So Medisa is a reputable retailer that, in partnership with Braun, they have released an Empower program that you can sign up as a member and get specialist members' prices. Delivery is quick, free, and they also offer free samples. They also have a Sydney storefront that you can physically walk into the store and access these products off the shelf. But best of all, they answer their phone calls and also reply back to you in a very professional manner.
Thank you, Aaron, for giving us practical tips on catheter selection. Can you tell us a bit more about Urology Nursing Solutions?
We are clinical nurse consultant services that specialise in continence and catheter care. So continence care is a very private matter, and we bring compassion and privacy and dignity. We obviously deliver professional help and obviously improve your quality of life through the services that we provide.